This is episode 575 of the Rio Grande Foundation's Tipping Point, New Mexico. I'm Paul Gessing, president of the Rio Grande Foundation, New Mexico's free market think tank. You can find out more about the foundation at riograndefoundation.org. I am very pleased to be joined for this week's episode by Katy Talento. She is the executive director of the Alliance of Healthcare Sharing Ministries. And we'll talk a little bit about what those are and how they're being impacted right now in New Mexico. But welcome to Tipping Point, New Mexico, Katy.
Thank you so much, Paul. It's a pleasure to be with you.
Yeah, and you've got one more follower on X as of 5 minutes ago. I went ahead and I was doing some background research, and I see you've been involved with healthcare policy in a lot of different areas, including the Trump administration. So before we get into what these health sharing ministries are, talk a little bit about your background in healthcare and specifically what you did with the Trump White House.
Sure thing. Yeah. So I'm an epidemiologist by training, ironically.
Oh,
Um,
wow. We love those people.
yeah. Nobody used to be able to pronounce epidemiologist until recently, but now everyone is an armchair epidemiologist. Yeah. So I did that by training, but I worked in HIV/AIDS for a few years, but quickly got sort of fell into working on Capitol Hill. It turns out that little Republican children don't grow up wanting to be public health experts, as we've all sort of witnessed lately. And so there wasn't anybody to do the Public Health Service Act portfolio on Capitol Hill for the Republican Committee of Jurisdiction in the Senate. And so my friends just sort of recruited me. I never wasn't qualified, but I ended up working on the committee that oversees public health. And I did that for a few years and realized, oh, I love this politics policy thing. And so I ended up staying on Capitol Hill. I worked for 5 different senators and a couple committees. I was kind of on and off. I was always trying to get out of government. I never really respected government and thought I was kind of a parasite. But I was always trying to get out. I was a nun for 2 years, and then I worked for helping ExxonMobil protect its overseas workforce from malaria for a couple years. But eventually, I was always lured back, just like, in The Godfather, just when you think you're out, they pull you back in. And so it was from there that I, again, sort of fell into helping the Trump campaign in 2016. I was sort of looking around and said, this guy's winning all the primaries. The voters love him. He's going to be the nominee. And so I can either help him and me and my friends can become his staff, or bad people can help him. So we decided to help him and never looked back. I mean, I saw his appeal to the voters and I understood why. And so I worked on the campaign, I worked on the convention, and then from there to the transition team. And from there, I became the healthcare lead for the Domestic Policy Council. In the White House, I was there right up until before COVID. So just before COVID, thank God I wasn't, sort of corrupted by the taint of the COVID response. But I left right before then. And since then, I've been an independent consultant on policy matters and also helping employers build health plans that are innovative and cost containing. But mostly what I love to do is I work with the Alliance of Healthcare Sharing Ministries as a really great non-insurance alternative for people of faith.
Well, I have a feeling I would have rather had you making decisions in the epidemiological field than rather than the people who did make those, and that includes the Trump administration. But we'll leave that whole sorry tale of woe for another conversation and get into what we're talking about here. Now, let's jump in here a little bit to what these healthcare sharing ministries are, because I'll just full disclosure say that I had one for a couple of years. They are, as I understand it, and you fill in or correct my mistakes, they are uh, they are religiously based. I think all of them, and they have a approach that is like health insurance, but it is avowedly not health insurance. But it's a group of people getting together to share healthcare expenses. So where am I wrong? What are these programs, and how are they rising in prominence and importance across the country?
Yeah, so you're right that healthcare sharing ministries are generally communities of religious believers. There are some secular based healthcare sharing organizations, but healthcare sharing ministries are ministries. So yes, these are anywhere from a small Mennonite village program to large nationwide, 500,000 people. Across the country and overseas. A lot of expats and missionaries participate in healthcare sharing ministries. It doesn't require you being in the United States to participate. We also actually, many of our ministries welcome undocumented migrants if for some reason they need a healthcare solution and they are people of faith. Then that's another thing that we often like to share with our friends across the aisle who may not be our friends for other reasons, but that usually pleasantly surprises them. Yeah, so the way it works is, and each ministry is a little bit different in exactly how they operate. So I'll try to generalize, but typically you've got a group of believers. They come together and they develop either themselves or they sort of have some leaders that develop this with them, sharing guidelines, and those guidelines are posted on their website, and they basically govern how sharing happens. So what types of medical bills are shareable, what types of expenses are not going to be eligible for sharing. With respect to religious groups, that usually means what you would think. Abortion related services are not shareable. Cutting the breasts off little girls, not shareable. So the obvious things, but also they commit to one another to really treat their bodies like temples of the Holy Spirit and to live in a healthy way. And that is something that's very different from insurance companies and insurance risk pools, where you make no such commitments. You owe nothing to the other members of your risk pool. You are in a contractual arrangement with the insurance company. That's very different than a healthcare sharing ministry, where basically we're not legally bound to one another, we're morally bound to one another. And so you go to the doctor or the hospital, the emergency room, you say, I'm not insured, I'm uninsured, but I have a healthcare sharing ministry membership. Some healthcare sharing ministries have an ID card, some don't. You just identify yourself as an uninsured cash pay or self-pay patient, and you get your care, you make your appointment or you get your care, they send the bill, and the bill is then uploaded to the ministry's portal. The ministry assigns other members of the ministry membership to share in those bills. And so you will either get directly checks from those other members, or those other members will authorize transfers to be made on your behalf from their accounts to yours or directly to the doctor or the hospital. Again, each ministry does this a little bit differently, but that's the basic structure. If people don't share that have been assigned to share your bills, then other members are sort of tapped on the shoulder to fill in, and the members that didn't share, we'll have a conversation with them like, hey, are you having a hardship? What's going on? To try to figure out what's going on with them. But you should expect that you're going to share a certain fixed amount every month. And that's usually based on your household size, maybe your age, not always. And then, that's what you share every month. Of course, like the biblical mandate around bearing one another's burdens, like in the book of Acts, chapter 2, there's also a biblical mandate that you bear your own load, and you only sort of seek the help of the community when that load becomes unbearable. So we do expect our members to pay their own bills up to a certain point, but when those bills become too expensive, that's when bills become shareable by the community.
So what you're describing is obviously different from health insurance in a couple of big ways. One is that there is a requirement, a burden of certain behavior placed on the people involved in the plan. And then the way it seems like the costs are shared amongst the participants is at least somewhat different. I mean, insurance has a actuarial system and everybody pays in and some people take out, but it's not necessarily insurance the way these sharing ministries work, right?
That's right. It's definitely not an insurance model. Some of the key descriptors of insurance from a legal perspective are that there is risk bearing, there's the assumption of risk, there's a contractual arrangement, there's a promise to pay, and that risk guarantee. So that is not anywhere in our healthcare sharing ministries. I sort of think about it like a homeschool co-op for healthcare. If you think about a homeschool co-op, all the parents have some sort of teaching obligation. Maybe you teach math once a week, or, but you take your kids, you know that they're going to get taught, but not because anyone's contractually obligated or, specifically required to teach your children. It's an agreement. It may be a written agreement, but it's an agreement among the parents and families that want to participate in the co-op. And that's sort of how healthcare sharing works too.
All right. So what's going on in New Mexico here? Well, let's stop before we get there. These plans have been around for a long time, but they became more prevalent, and most people, I think, probably started to hear about them in the wake of Obamacare. Is that your experience as well? And why would that have happened?
Yes, so you're right. Most of the healthcare sharing ministries, certainly the ones that are in the alliance that I represent, have been around for decades, either in the 80s or 90s, at least. There are Mennonite and Anabaptist communities that have been around far longer than that. But the large nationwide, federally recognized healthcare sharing ministries have all been around since the 80s or 90s. So the reason why the Affordable Care Act was so important to healthcare sharing ministries, which is unusual, most of the things that we have to say about the Affordable Care Act are, it's not really affordable, it's not really caring, it doesn't really serve its purpose, it's driven up premiums. There's a lot of problems with the structure of the Affordable Care Act. But I will say that one good thing that happened, basically by some sort of Christmas miracle brought to us by Senator Grassley and Senator Max Baucus, who ran the finance committee in the Senate at the time of the ACA passing, is that they gave an exemption from the bill's individual mandate. We're all required to buy insurance that is defined by the government as adequate. And if we didn't, under the law, there was a penalty that you had to pay. Now, in 2017, President Trump and the Congress passed a law that zeroed out that payment penalty, but the mandate's still there. You're still asked on your taxes every year if you have qualified health insurance, and if you don't, there's nothing that happens to you, but you're technically required to have it. And so the Congress exempted members of healthcare sharing ministries from complying with that requirement. And so as insurance carriers, it's hard to remember 10 years ago when the insurance exchanges were first rolling out, but the premiums were high. There were a bunch of carriers that had been in communities and zip codes that left, so that there were bare counties that didn't have any offerings for the Affordable Care Act. It was kind of a mess. The healthcare.gov website didn't work at all. And so it was a mess. And people were very much looking for an out, some sort of escape hatch from this. And, I think our membership of healthcare sharing ministries doubled, tripled, quadrupled even after that, because it was a legal option for people of faith to choose. Now, over the years, and even especially in recent years, there's even more reason for people of faith to choose a non-insurance option. And that has to do with the insurance mandates at the state level and also at the federal level. Your premium dollars in many, many states are going to forced participation in subsidizing abortions of other members of the risk pool, other people who are enrolled in insurance, of transgender surgeries, of in vitro fertilization, all kinds of procedures that Christians may have religious objections to. And yet there's no way out. Like, these states require all insurance policies to cover these procedures and services and therapies. And so there's really only one out if you want to have a healthcare solution for high cost of medical bills, but not be in that model, and that's healthcare sharing ministries.
All right, now let's talk about what's going on here in New Mexico and why these ministries are under attack.
Yes. So because it is an exempt, our members are exempt from the Affordable Care Act, you have a lot of people on the other side of the aisle, especially in the Democrat side, that They really think that the Affordable Care Act is the only safe place for anybody to receive their healthcare financing. There's no better way in their mind. There's no safer way. There's no better coverage, more secure protections for consumers or for the public than to have an ACA plan. And I think they have this view out of good intentions. I mean, isn't that always how mommy government or daddy government comes into our lives? But that, their view of the situation really colors how they view non-ACA options. And so you'll see blue states that really go after alternatives, whether they're insurance alternatives, such as short-term limited duration plans, association health plans, or whether they are non-insurance alternatives, such as healthcare sharing ministries. And they just don't like them. They want to drive them out of their state. They think that in some ways they think they're scams. I think, to be fair to some blue state regulators, there have been bad actors in this space, for-profit entities that have launched nonprofit front groups pretending to be healthcare sharing ministries and literally scamming people, people of faith. And so who get signed up by some for-profit entity, give their money every month, and then there isn't any sharing community there for them when they have a bill that they need shared. That has happened. And because it's happened, that gives even more of an excuse to insurance regulators in blue states to start saying, you know what, we need to find ways to get this scam of an operation out of our state. And so this was particularly acute in 2017 and 18, when this particular set of bad actors, this for-profit brokerage firm called Alira Companies and their nonprofit front group called Trinity Health Share, which later morphed into other names. But eventually, these guys really scammed people. And that is when a lot of insurance regulators started saying, okay, this is our excuse. We're going to go after those bad actors as unlicensed insurance in our state. And we're going to use our insurance code to shut them down. Now, one thing that was happening in the backdrop of all this is over the past 10 or 15 years, sometimes longer in some states, 31 states in the United States, does not include New Mexico, but 31 states have recognized in their insurance code that there is an exemption from the insurance code for healthcare sharing ministries who, meet certain criteria. So it recognizes, it's not saying, hey, healthcare sharing ministries are insurance, but we're just going to pretend they're not. What it really does is it recognizes that we're not actually insurance. And, that's because we're not for profit and we share medical bills. We don't have a promise to pay. We have a notice to consumers that lays all this out, that this isn't insurance and what you're buying is not insurance. And we're not an insurance company, like all these consumer protections. And if you meet these criteria, actually, you're not insurance. And so it recognizes that these organizations are not insurance subject to the state insurance code. It's the states that regulate insurance for the most part, although the ACA did sort of interject the federal government more than ever before. Still, primarily in the individual market, it's the states that govern insurance, and every state has a very long and labyrinthine insurance code. So what a regulator will do is they'll come after a healthcare sharing ministry and they'll accuse them of being unlicensed insurance, and they'll say, cease and desist. You're unlicensed insurance, cease and desist operating. And, we can appeal this. We can hire a bunch of expensive lawyers, and our ministry can appeal and work through the administrative process. Usually you can't even go to a court until you've worked through the administrative proceeding. So this is a multi-year process. At the end of the day, we usually win, or the state settles with us, because ultimately it's on them to prove that we are insurance, because it's hard to prove that we are insurance because we're not. Now, they might be able to prove that, just because we're not insurance doesn't mean you can't have a bad healthcare sharing ministry. You could have a bad healthcare sharing ministry, just like you could have a bad church where the pastor is embezzling from the, pass the hat collections. You can always have bad actors in any operation, but that doesn't mean that we're insurance. And for the most part, legitimate healthcare sharing ministries, such as members of our alliance, such as ministries that have been accredited, there are a number of ways that consumers can sort of check the box and see if they're joining a reliable organization. But for the most part, it's very difficult to prove that we're insurance. So what ends up happening is a healthcare sharing ministry that doesn't want to continue spending hundreds of thousands of dollars or millions of dollars on lawyers in a given state for years and years will settle with the state, and they will agree to just close up shop and leave the state, and live to fight another day in the other 49 states, especially the smaller ministries that have under 100,000 members. They particularly don't have resources to hire lawyers, and so they're the ones that suffer the most under this scheme. The bigger ministries will fight a little harder. They will sue. They will they will fight harder. So that gets me to where we are in New Mexico. So New Mexico does not have one of those statutes that exempts us from the insurance code. And in fact, what's very strange about New Mexico is their insurance definition. So what is defined as insurance is insanely broad. In fact, in some court proceedings that happened recently, they were asked, the state insurance commissioner's office was asked, or the superintendent's office was asked, okay, well, under the definition, as you're interpreting it, of insurance in New Mexico, 5 members of a church who got together to help pay a medical bill for, Pastor so-and-so, if they pooled their money to pay for a knee replacement for the pastor, that would be considered insurance under your interpretation, right, state? And the state of New Mexico said, correct. So, we think that's a pretty crazy insurance definition. And if that is in fact the definition of insurance, it's probably unconstitutional on a number of levels. But for the most part, what New Mexico has decided to do, the insurance supervisor there is extremely hostile to healthcare sharing ministries. He has put out a number of consumer bulletins, which are basically like buyers beware, don't enter into these healthcare sharing ministries. They're not insurance. So first he's putting out warnings that we're not insurance and that consumers should know that we're not insurance. And so don't join us. And then on the other hand, he's accusing us of being unlicensed insurance, and taking us to court. So for the past 5 or so years, the office of the superintendent has shut down, through this procedure I just described, sending cease and desist orders, shut down like one ministry a year. And some of this, he's gone after some of the lower hanging fruit first. That is the smaller ministries that don't have the resources. Now he's starting to go after the bigger ministries. And he's even, sent emails to some of our ministries saying, oh, I know your insurance. So this is a very hostile situation. And what happens when you have a hostile situation, it's basically a textbook case of religious animus, and it's unconstitutional. And so he went after Liberty Health Share recently, and Liberty Health Share, I don't speak for Liberty, although they are a member of the alliance, but I can, this is a matter of public record. And we filed an amicus brief in Liberty's case. But they went after Liberty, and Liberty went through, all the state courts, and they're extremely hostile judges that they did not get a fair hearing. And so what ended up happening is Liberty filed in federal court for, violation of its religious liberty and a bunch of other unconstitutional actions. And so that process is working its way. I think it could go all the way up potentially. Another large ministry that has not been targeted by one of the largest ministries that has not been targeted by the superintendent's office yet, filed also in federal court in New Mexico, suing the state preemptively, because basically what the state is saying in its case with Liberty and in all its other cases is that all healthcare sharing ministries are insurance and should be shut down in the state, whether or not the state has actually come after them. And as a result, no healthcare sharing ministry is really safe. And some of them have chosen to stop enrolling new members because it's just not a safe regulatory environment. And that includes one of these larger ones. So they also sued preemptively in federal court. So there are these two very serious federal actions that are going on. And we will see what happens. It's very possible that the federal district court, we might win, we might lose in federal district court. But when it goes to the 10th Circuit, we'll have to see what happens. There's some really good case law out of the 10th Circuit. And certainly the 10th Circuit is where Colorado is. And Colorado has had a lot of religious liberty jurisprudence happening, especially with the Masterpiece Cake Shop and the 303 Creative, where you had real outright animus from the state government towards religious people and religious businesses and organizations. And it's just been one sort of hostile action after another. And those cases went up to the Supreme Court. The religious plaintiffs in those cases won every time. And we have a very friendly Supreme Court towards religious liberty. And that's what's going on in New Mexico.
Wow. All right. Well, that's a lot. There's a few kind of housekeeping or kind of questions that I want to insert here, or details. So first, New Mexico's health commissioner is appointed by the governor. And given our governor's politics and her approach to anything relating to freedom, it's not a surprise that she has come after you. So I assume you've seen this trend in predominantly blue states, or at least with very progressive left-wing governors, right?
Yes, it's basically like whack-a-mole out there. You know, the alliance is often having to deal with either bad legislation coming out of blue states, misguided legislation. Sometimes we get misguided legislation coming out of red states that we have to sort of educate around. But yeah, it's from when it comes to hostile insurance commissioners, it's almost always a very, very deep blue state that we have problems in. California, Maryland, Massachusetts. That Colorado has a really, really Democrat supermajority in its legislature. So these are problem areas for us.
Okay. And the interestingly, court challenges are on the religious freedom basis, which, obviously I look at this, and as somebody who was with Medishare being one of the larger health sharing ministries out there, I've seen it from the inside. So, certainly look at it as a religiously based thing. They make sure that you share their values, and there's always a prayer-based emphasis. So there are religious aspects to it, but you also look at it as a way to share your healthcare costs. Is that obviously the courts over the years and decades have been very relatively differential to religious concerns as opposed to just freedom of association and that kind of thing? Are pretty much all the court cases that you filed always based on religion? Is that the way you've always litigated?
Well, we usually throw all of our arguments into a complaint or a response. We don't usually have to sue. We typically win in the administrative process. Either like a state like Maryland actually went after all the healthcare sharing ministries, sent cease and desist to every single one of them a few years ago. Because Maryland actually does have one of those exemptions in their insurance code, although it's very old. And so some of the language was kind of outdated and was being used to insinuate that we weren't compliant with it, and therefore they could come after us. At the end of the day, Maryland had better law for us than New Mexico does. And so at the end of the day, the Maryland insurance department basically just caved. They settled with our guys because we had filed federal lawsuits and they were going to lose. Or I think they thought it might be too hard to win. So typically we use religious liberty arguments, first of all, like regardless of what you think we're religious, and you can't, engage in any type of scheme that would continuously monitor us. So that's the first argument. And there is a really important case called Medina that was in the 10th Circuit. I think it was in the 10th Circuit. And basically it was actually an insurance plan, a church plan that was actually insurance. And they were being accused of needing to comply with the federal law, the ERISA statute, that would have required them to engage in a bunch of different requirements and reporting schemes and whatnot. And they basically said, even though we are insurance, but for our religious nature, we would be under the statute, because complying with the statute would put the government all up in our business. we are not required to comply with that statute the way a secular insurance plan would be. And they won. So even if we were insurance, which we're, very certainly not, but even if we were insurance, the state cannot regulate us, cannot regulate religious organizations in that way. They cannot require a bunch of regular reporting. They cannot be all up in your business demanding to know like how you spend your money and how much you think about it from a church perspective. Like, how much are you paying your pastor? What did you do with your offering from last Sunday? Who's your janitor? Who are the vendors that you use? Like, you can't ask churches that. You can't demand that. The government can't be all up in religious people's business like that, thankfully. And so even if we were insurance, they can't do that. So that's sort of our first argument. Our second argument is usually, but we're not insurance. And here's all the reasons why. And so we lay that out. And then, of course, yes, there are other aspects of the First Amendment usually that come into play. Often these states are trying to force us to say things, often things that aren't true. For instance, they may require us to try to say to consumers, hey, if you join us, you might not, you might be subject to the ACA tax or the mandate penalty. Well, that's just not true for our ministries because they are exempt from the ACA for their members. And so if you're a state that's trying to force religious people to say things at all, but certainly things that aren't true, then that's a different kind of First Amendment violation. There are associational violations as well under the First Amendment that happen. Certainly these are people that are coming together that are choosing voluntarily to associate. And you can't interfere with that. You can't ban that or prohibit it. And so we tend to win when we, fight on these fronts. We tend to win. There has not been a court, as far as I know, that has actually found that we are for sure insurance and should be regulated as such that I am aware of in all these decades. So yeah, I think we have a good chance of winning. I'm not sure we'll win at the lower court level. We'll have to see.
All right. And, this one gets into a little bit of kind of understanding the mindset of the people we're engaged with here. But, we look back to the era of Obamacare, and there was a lot of debate about it. It obviously put the federal government in a much more powerful position when it came to regulating health care and health insurance, and just the whole industry of healthcare than it was before. And the people who support that law, Obama and other people on the political left, why do you think they are coming after health share ministries, which I don't know what percentage of people are a part of this? It seems like such a small group that they're not really impacting the broader insurance market or the power structure when it comes to healthcare. It seems very strange, but it really is, to me, all about power and keeping people in line. But correct me if I'm wrong.
Yeah, I mean, you're right. I think that there are a number of reasons. Like I said earlier, I think there are some good intentions there. I think that they view the ACA as a solution basically for sick people. Remember, the ACA put into place the pre-existing conditions requirement that, no matter how sick you are, insurance companies have to insure you. It's sort of like requiring Geico or Allstate to insure your car after you've already wrecked it. So that drives up costs. But because that drives up costs, it's very important to insurance commissioners to make sure that you have a bunch of healthy people in the pool to help keep those costs down, to spread those costs of all those sick people around. The insurance pool in the ACA marketplaces, those marketplaces are much sicker and older than sort of an employer-sponsored insurance pool, for example. They're a sicker, older, more expensive pool. The only way to spread those costs around is to have more and more healthy people in them, which is kind of the genius, the evil genius, if you will, of the ACA structure and the individual mandate. That's why they had the individual mandate. And it's why they had the employer mandate. You have to require people to buy this product that they don't want to buy or they can't afford to buy, and they don't need because they're young and healthy. You have to require them to, or else the market will go into a death spiral, which is a known term of art in the insurance space. It means that when you have a risk pool that is so risky, it becomes so expensive that the non-risky people leave because they can't afford it anymore and they're not getting value. So when they leave, it gets more expensive and more risky, and then more people leave. And so that's what we call the death spiral, to where really you only have cost and you have no revenue coming in. Which is kind of similar to the Medicare program, right? You basically have so many people that cost because they're at that stage of their life, and there's no revenue. Like whatever they're paying in, premiums and Medicare Part B or whatever, it doesn't even come close to covering their costs at the end of their lives, which is why the government had to step in and sort of take over this program, take over meeting this need rather. So I think that from a pure, like, to be totally fair to this point of view, that's a lot of why they see anyone who's outside of that pool as a threat to their pool. So they want all our members back in their pool. Now you might say, well, gosh, in New Mexico, we're just talking about just over 3,000 people that are in healthcare sharing ministries in New Mexico. How could we possibly be a problem for them? And, so then there are other reasons, and I'll get to those in a minute, but back to the pool problem. If you look at some states where there are just a ton of Christians, and Christians are a very dominant culture in that state, places like Colorado, places like Texas, Florida, those are huge and important states for healthcare sharing ministries. We have a lot of members in those states. In Texas, we have over 100,000 members. In Texas, if I recall, it's tens and tens of thousands of members in Colorado. That actually would be useful to the insurance commissioner, to, if all those people were not in healthcare sharing ministries and they were in their insurance pool. The problem that I always respond to those guys with is, you're assuming that if you shut down healthcare sharing ministries, that all those members would buy ACA plans and they would join your pool. They would not. Either A, they're priced out, or B, they're violating their conscience because you're requiring crazy things in insurance. And so it violates their religious objections. This is how they think Jesus would do healthcare in a healthcare sharing ministry. They're exercising their religious beliefs. They're not going to buy into your pool. So no matter what you do to us, you're not going to get all these people. You're probably not even going to get most of them. So now I think their theory is flawed, but I understand what the theory is. Now, in a place like New Mexico, where, again, we're like 3,000 people, are you kidding me? We can't really help you solve your death spiral problem. There are other things going on. So the two other things that they will cite is that we don't provide enough protection as a insurance policy would, especially one that you can buy on the ACA. And people are joining who don't realize that we don't have all these protections. And what they usually mean is, pre-existing conditions protections or guaranteed issue protections, or, you get free mammograms for life and all the preventive healthcare, you get free contraception forever. And there are many things that healthcare sharing ministries are different from insurance on. And but our ministries, most of them do accept people who have pre-existing conditions. They may not share in bills arising from those pre-existing conditions for a certain waiting period. But they do welcome members who have pre-existing conditions. So it's not quite fair the way these commissioners are characterizing our program offerings. But the other reason, so they think that we're just like cheaper, shoddier insurance. That's what they think we are. And they think that people who are joining healthcare sharing ministries are just dumb, or they're poor and they're looking for something cheap. They're just looking for cheap insurance, and they're dumb and they don't realize that what they're getting when they join a healthcare sharing ministry. And that's just insulting. Like, our members they do know what they're getting. And if you look at the complaints that the insurance commissioners get from people who are enrolled in insurance who don't realize what they're getting and don't understand their policies and haven't read all the fine print, there are far more complaints by people who are enrolled in insurance than people who are members of a healthcare sharing ministry.
All right. Well, we only have a couple minutes to go. So is there anything an average person can do aside from trying to get rid of the governor in the next election, which she's term limited out anyway? So we're kind of stuck with her for a few more years here. But what can people do, and where can people go for more information about these plans if they're not familiar with the Christian Health Share Ministries? They are more affordable than traditional health insurance. And, like I said, I was happy with the plan I had while I had it. And then my wife's company got purchased, and they replaced a very mediocre health insurance plan with a very good health insurance plan. And that's the only reason we jumped off. But what can people do, and where can they go?
Yeah, so I think the first thing that people should do is if they're considering a healthcare sharing ministry, they should ask some hard questions to make sure that the organization that they're exploring is an authentic healthcare sharing ministry, that they can, join with confidence. And so the first thing they should do is ask, are they a member of the Alliance of Healthcare Sharing Ministry? We have a set of minimum standards that help protect consumers. The second thing they should ask is, have they been recognized by the federal government as a healthcare sharing ministry that is in fact exempt from the ACA? Or from the ACA's individual mandate. And you can ask them for a letter from the Department of Health and Human Services. All the ministries that do meet that exemption have a letter from the federal government that they can send you. You should also ask if the ministry has been accredited by the Healthcare Sharing Accreditation Board. And if they haven't, because that board is somewhat new, are they undergoing that accreditation process? So they should definitely ask that. They should ask to see their audits. Those audits are required by the ACA to be made public upon request. They should definitely read very carefully the sharing guidelines, which are available on the ministry's website, to make sure that they understand the program and what types of bills are shareable and what types are not, and how the process works for that ministry. So I think if they do all those things, they can join the ministry that they're exploring with confidence. I certainly recommend our 5 ministries. MediShare is one of them, Samaritan Ministries International, Altrua Health Share, One Share Health, and Liberty Health Share. So these are all solid organizations. And I do think that if they want to sort of weigh in with the government in New Mexico that is persecuting healthcare sharing ministries, they can call the Office of the Superintendent and let their voice be heard. They can leave a message. They can email the Office of the Superintendent and make a complaint for how they're treating healthcare sharing ministries. They can also contact their state legislators. We know that the legislature there is pretty hostile to us, but that doesn't mean that every legislator, even though they might be on the other side of the aisle, that doesn't mean that they're totally hostile to religious people and that they want religious options in healthcare to be shut down in their state. So it's worth letting them know what's going on and complaining about it. So that's what we'd recommend right now. So we just pray for us. We really need prayers as we go forward in these legal proceedings. We know the importance of prayer in some of these matters. So that's really what we'd ask at this point.
All right. Well, thank you for your time, Katy, and I really appreciate all the information, and hopefully it's given people a little bit broader idea of what is available for them when it comes to healthcare and paying for those unforeseen expenses. So thanks for listening to this week's episode. Find all episodes at tippingpointnm.com or at the Rio Grande Foundation's YouTube channel. Subscribe to the show at Apple, Stitcher, or tell Google Home to play Tipping Point New Mexico. Thanks to Path 3 Marketing for producing this show.